With regards to classification, the shoulder, patella, and hip dislocations are characterized by the direction of the dislocation. Shoulder dislocations are either anterior, posterior, or inferior. Hip dislocations can be anterior or posterior, with posterior dislocations comprising the majority of traumatic dislocations. There are several classification systems used to describe posterior hip dislocations. These include the Thompson-Epstein classification, which is based on radiographic findings, and the Stewart and Milford classification, which is based on functional hip stability. The majority of patellar dislocations are lateral dislocations. These can also be characterized as primary, meaning a first dislocation, or recurrent dislocation. Elbow dislocations are characterized as simple or complex. Simple elbow dislocations are defined as acute dislocations that occur without a fracture. Complex elbow dislocations involve concomitant fractures of the proximal radius, ulna, or distal humerus. They can also be classified based on the direction of displacement of the radius and ulna with respect to the humerus. A posterior dislocation of the elbow associated with a fracture of the coronoid process and the radial head is described as the terrible triad. Finger dislocations are characterized by the specific joint involved, MCP, PIP, or DIP. They are further described by the direction of displacement.